Immediately when the bill was signed, it became impossible for us to see Medicaid patients, and so we had to start turning them away at the door.
It ripped Medicaid away from the people who need it the most.
People did not know what was happening.
It was mass chaos.
The shutting down Planned Parenthood shut down healthcare.
It is very scary to think about what would have happened if we had not secured state funds for care for our patients here in Colorado.
He is signing this bill into law right now.
Kicking 14 million people off their health care.
Planned Parenthood facilities are closing their doors.
H.R. 1 directly targeted Planned Parenthood and said even though other providers provide abortions, we're going to target Planned Parenthood specifically.
And so overnight, instantaneously, every Planned Parenthood in the country got removed from Medicaid. What that meant was that patients who are insured through Medicaid could no longer use their insurance at Planned Parenthood.
It was devastating. Not only did you have people showing up for appointments that they had on the books for months, they also couldn't pay out of pocket.
In Colorado, Medicaid patients can't pay for services. In this very unique case, it meant that people just couldn't receive care.
And so they just had to be turned away.
This included urgent appointments for abortion care, for miscarriage management, appointments to get the results of STI tests, appointments for checkups and cancer screenings.
You don't make an appointment for a cancer screening unless something very serious is going on. And to have that rug literally be pulled out from underneath you is devastating.
When the federal government behaves badly and singles folks out and denies care, we need to step up.
There were a ton of conversations happening around how do we close the massive hole that's been blown into our state budget, and how do we ensure that people continue to have access to Planned Parenthood.
And so we knew that as a state, we had to then provide funding to our own healthcare system. Across the aisle, we had to remind people in the state of Colorado the role that PPRM played in communities.
I really felt like Planned Parenthood gave me the care that I needed at that time in my life.
I was working as a waitress and I found a lump in my breast and I wasn't sure what to do, and they supported me when I was young and poor and uninsured.
Our communities rely on Planned Parenthood and the services that are covered.
And it's life-saving care that's necessary.
And it should be accessible to all communities, no matter what your financial situation is.
And the legislators were able to have those conversations with the governor's office to make it be known that this was something important to us and to the people who voted us in office.
And so we were able to demonstrate that we could afford it.
And the governor's office agreed. And so we found the money, we made this happen, and I couldn't be prouder.
Holding my daughter and making the case for why everybody, including patients on Medicaid, should have access to Planned Parenthood. That to me was one of the most beautiful moments of my career as a legislator. It was all about fighting for her future, but for everybody's future.
And it felt good to know that we were doing that on behalf of real people. It wasn't just a political win.
There are certain things that you do, you come full circle and you're like, I remember this is why I do this. This was certainly one of those things.
This is about getting that legislation passed, and I'm just grateful that I was in a place to help make that happen.
And it's truly because of the courage and the fast work of our 4 champions that we're honoring tonight that we are able to say we've provided care for these people who use their insurance in the form of Medicaid, and they can receive the full spectrum of reproductive health.